Hello, I'm Dr. Nicholas Cohen, and I'm here to share with you a top 10 list of tips for pink eye, how to identify, prevent, and treat. The medical name for pink eye is conjunctivitis, and it's caused by either bacteria, virus, allergy, or something getting caught in your eye. What you'll have is a red eye, and there'll be some discharge. If you have bacterial infection, if a bacteria is the cause of your pink eye, then you'll have thick pus, and as soon as you wipe the pus away, a couple minutes later, the pus will be back. That's really what separates bacteria causing pink eye compared to the other causes. You'll have a thick yellowish, greenish, or white discharge that goes throughout the day and comes back a couple of minutes after you wipe it off. Tip number 2 is to recognize some of the red flags for pink eye. Any of these red flags mean that you should go to the emergency room if you can't get in to see your doctor or eye doctor immediately. Difficulty seeing, having a red ring around your eye as shown in this picture. This is called ciliary flush, and it's a sign that you might have a serious eye condition. Also, not being able to stand bright light, not being able to keep your eye open because it's swollen shut or you feel there's something in there, and having a severe headache with nausea. Tip number 3 is to see your doctor. I recommend seeing your doctor in all cases of pink eye or conjunctivitis, just to make sure you're not dealing with a bacteria or something worse that could cause you to lose your vision. One of the things your doctor will do is to shine a light in your eye. As you can see in this picture, this is a normal eye. When you shine a light in a normal eye, it gets smaller. The pupil gets smaller. A fixed pupil, meaning the pupil doesn't change in size when you shine a light in it, is a very serious sign that you have something wrong, and your doctor will have you seen by an eye doctor immediately. Also, a cloudy cornea. Here's a cornea, and here it's cloudy, you can see, is another sign that your doctor will look for to make sure your eye infection isn't serious. If there is a cloud of cornea, it's an emergency, and you'll need to be seen by an eye doctor immediately. Your doctor, again, will be able to refer you in any case where your doctor is not sure of what's going on or if your doctor detects that something serious is going on. Tip number 4 is how to prevent pink eye. So pink eye that's caused by infection, like bacteria or viruses, is very, very contagious. So it's important to wash your hands frequently when you hear someone washing their hands if you have pink eye, to avoid spreading it to other people. And if you're around someone with pink eye, to make sure that you're washing your hands frequently as well. If you live with someone who has pink eye, don't share handkerchiefs or towels or bed sheets or pillows, because that's how contagious it is. And if your pink eye is caused by allergies, and then avoid triggers for allergies. So people will often get pink eye or red eyes from cats or other animal dander, from dust, here's a dust mite, and from cockroaches. All of these things cause allergies. So you should make sure if they're the cause of your allergy, that you stay away from them. Tip number 5. This is a special tip for people who wear contact lenses. If you wear contact lenses and you develop pink eye, it's even more important that you see your doctor, because you can have a serious eye infection called keratitis, which is infection of the cornea. If your doctor does determine that you do have a bacteria, if you do wear contacts and your doctor does determine that the cause of your pink eye is bacteria, then you'll need a special antibiotic called ciprofloxacin, or another kind of antibiotic that belongs to that same class. It's very important that you not wear your contact lenses for the first 24 hours of being treated for a bacterial infection, and that if you own disposable lenses, that your disposable lenses are thrown out, that your contact lens case is thrown out, And if your lenses are not disposable, then it's very important that your lenses soak overnight. Tip number 6. If your doctor does determine that you have a bacterial conjunctivitis or bacteria causing pink eye, then antibiotics are recommended. Your options are ointment or drops. Ointment, which goes in a strip under the lower lid, is recommended for children because drops are too difficult to get in their eyes. And it's recommended for adults who have trouble with eye drops. Because it causes blurry vision for 20 minutes after you put it in, it's not ideal for adults who probably would prefer not to have blurry vision after they put in their treatment. So that's why I recommend drops for adults. You put 1 to 2 drops in the affected eye only. For both treatments, you use it 4 times a day for a total of 7 days. If you do not have an improvement with bacteria, with these antibiotics after 2 days, then it's important to go right back to your doctor, because the infection that you have might be by a bacteria that is not affected by the antibiotics, and your antibiotic might need to be changed. Tip number 7. So we talked about the treatment for bacteria conjunctivitis. Now let's talk about the treatment for when your conjunctivitis or your pink eye is caused by a virus or an allergy. I recommend antihistamine decongestant drops, and I have 2 examples here. If you look at what's in them, and then you can go in a large pharmacy, you can find a generic that will probably cost less and it will be just as effective. I'm showing 2 brand names here, naphcon-a and Visine AC, and it's recommended that you use 1 to 2 drops 4 times a day. It's very important when using drops that are decongestants that you do not use them for more than 3 weeks. Tip number 8, another tip for people with allergic or viral conjunctivitis is eye lubricant. Examples here are Refresh Tears, Tears Natural 2, and Hypo Tears. Again, if you look at what's in them and then go next to them in the pharmacy, you can buy the generic, and it will undoubtedly be cheaper and it will be just as effective. Again, you'll have an options of drops or ointment, and I recommend the drops. You can use either the drops or the ointment, but the drops are probably easier for adults. The ointment is probably easier for children or adults who have difficulty with eye drops. For the drops, it's recommended that you do 1 to 2 drops every hour as needed, and for the ointment, it's recommended that you put it on at bedtime under the lower lid, or you can use it 4 times a day as needed. Tip number 9, if you are being treated for a bacterial conjunctivitis or pink eye caused by bacteria, then many schools will not let your children back in school until they've been treated for 24 hours. It's important for anybody being treated for bacterial conjunctivitis or pink eye caused by bacteria not to go back to work or to school for the first 24 hours of treatment. It's really ideal that you wait until the discharge stops before going back to school or back to work, but most people can't afford to wait that long. At the minimum, you should wait 24 hours you should have 24 hours of treatment with an antibiotic before leaving the house. And tip number 10 is to believe in yourself. Having conjunctivitis or pink eye is extremely common. I've discussed some of the ways of knowing when your pink eye is serious. I've explained that it's important to see a doctor whenever you have pink eye, and I've discussed the treatments for pink eye and ways to prevent it. I hope these tips have been helpful. Thank you very much for listening, and have a great day.